Nick? That look good to everybody? Hi, everyone. As Nick said, my name is Bryn, and I'm the consultant and trainer for cognitive remediation here at the Best Center. And today I would like to talk with you about cognitive health. In order to understand why cognitive health is important, we need to understand what is cognition. Put it simply, cognition is our thinking, but really it's a lot more than that. Cognition includes many abilities that work together for our optimal functioning, including but not limited to attention, memory, processing, problem solving, organizing, communicating, and so on. Let's look at a scenario to see all the ways our cognitive abilities help us in an everyday occurrence. If you are given a doctor's appointment, you need to pay attention to the administrative assistant, understand what has been said or written, think about other appointments and obligations you have planned so as to avoid a schedule conflict. Remember to write down the appointment and then remember to look at the calendar on the designated day. You also have to be able to plan how you will get to the appointment and then organize yourself to make sure you are there on time. You may even want to make notes about the things that you will need to discuss at the appointment. So using cognition looks like this. To get to the doctor's appointment, you need many cognitive skills all working together: attention, language comprehension, memory, organization, and planning. It can be hard to get to the appointment if these skills are not working well. You might be emotionally ready and willing to have the appointment, but if you don't remember it or if you double book something, then you might miss it. So now that we see how these cognitive abilities help us in everyday functioning, let's look at what cognitive health is. A healthy brain is one that can perform all the mental processes that are collectively known as cognition. A healthy brain can handle that scenario that we just looked at. A healthy brain can also learn new things, use judgment and intuition, what some might call social wisdom, or even common sense. Good cognitive health is often referred to as staying sharp or thinking clearly. If you are working with someone in good cognitive health, you might notice these points: being able to focus for stretches of time, being able to recall someone's name, keeping your schedule and keeping it up to date in your mind, cooking a new meal with minimal difficulty, thinking and speaking coherently, and using your common sense. In contrast, poor cognitive health might look like this: difficulty with focus, not being able to recall names, missing appointments, not initiating new activities or having difficulty doing so. Your thinking and speaking might be disorganized, and you may use poor judgment. Cognitive impairment, like so many things, can be viewed on a spectrum ranging from mild to severe, with the potential to swing either way depending on the circumstances. Unfortunately, poor cognitive health can impact lives on an even greater scale. There can be an impact on community, with people being unable to live independently. Someone being of school age, the formative years where problems with attention, memory, and problem solving can stop you in your tracks. If you are working or in a career when cognitive problems begin, it's not hard to see how that could affect your ability to maintain and succeed. And relationships suffer when a person with cognitive impairments is not able to attend to or remember what a friend said. Just checking on your memory here. Do you guys remember this situation? Well, now that we know what cognition and cognitive health are all about, here's something to consider. How well would you handle this situation if you were in poor cognitive health or had cognitive impairments? Let's look at cognitive impairment risk factors and causes. We know that pre-existing or coexisting conditions can cause cognitive impairment. And while age is the primary risk factor for cognitive impairment, there are many other factors and causes to consider, such as family history, education level, has there been an injury? Some medications and medical conditions such as heart disease or stroke can cause cognitive problems. We also know that mental illnesses such as schizophrenia are likely to cause cognitive impairments. So with so many risk factors, you might be wondering, how do you maintain your well-functioning brain? How do you keep your memory sharp? Or maybe you're thinking about a family member. My son seems to have a really hard time focusing. How can I help him with that? Well, doing a Google search produced about 209 million results for how do I get a healthy brain? So how do you know what's correct? What's the best option? You look for research, evidence, things like that. And there's a great deal of research and evidence behind the things that are listed on this slide. And when you receive the PowerPoint presentation for this, I have pages of references if you want to look into any of these. So in addition to warding off high blood pressure, some cancers, fighting off depression, studies suggest that exercise can also ward off cognitive decline. A Mediterranean style diet has long been recognized as promoting better cardiovascular health and lowering risks of certain cancers, and promising research shows that it may protect against cognitive decline. And this is something I thought about in thinking about coordinated specialty care for first episode psychosis. This is a good example of where, say, case management can help a client develop a grocery list and then help the client navigate the grocery store. So it just kept popping up in my mind as I was putting this stuff together. Sleep. Our bodies rely on regular sleep for a variety of essential functions, many of them in the brain. Studies have shown that people who regularly sleep less than the recommended 7 to 8 hours a night score lower on tests of mental function. This might be because learning and memories are consolidated during sleep. Therefore, getting consistent, good quality sleep is known to improve overall health and may prevent cognitive decline. Maintaining a healthy brain often equates with the habits of staying mentally stimulated as you age. People with strong social ties are less likely to experience cognitive decline than those who are alone. By contrast, depression, which often goes hand in hand with loneliness, correlates to faster cognitive decline. In addition, having a strong network of people who support and care for you can help you lower your stress levels. And social activities require you to engage several important mental processes like attention and memory, which can also bolster cognition. And as for remediation, as Google showed us, you can find a lot of options for improving cognitive health. However, experts agree that there are certain things that an excellent cognitive remediation program depends on, including the type of program depending on what caused the impairments. Was it an injury or was it a degenerative disease? It will also depend on your caregivers, providers, and prescribers. It will depend on your treatment plans, not only being created from assessments and histories, but also being based on your client's personal goals and interests, because the more invested the client, the better their progress. An optimal plan incorporates a combination of group work, computer work, and bridging activities. Lastly, a holistic approach which integrates cognitive remediation with all aspects of an individual's goals for recovery, because again, the more invested the client, the better the outcomes. All right, let's talk about all of this specific to coordinated specialty care for first episode psychosis. So in the same way your heart is compromised when you have a heart attack, the brain is injured in a psychotic episode or brain attack. In most FEP clients, we know that early treatment leads to better outcomes and recovery. With schizophrenia, however, we see how easy it is not to follow recommendations of treatment because of the following: lack of insight where the client might not feel that they need treatment, side effects of medication. So proper care and medication management is needed in order to stave off side effects that could increase the chances of non-compliance. I mean, would you guys continue to take a medication that was prescribed for you if it made you feel sick or extremely tired? There might be low motivation that's caused by negative symptoms, memory problems, forgetting medications due to cognitive impairments, lack of information or support. Most people are uninformed about FEP and schizophrenia and the devastating effects it can have. Substance abuse can lead to non-adherence of treatment all around, as well as increasing chances of relapse. And unfortunately, with each relapse, there's more damage to the brain, which equals more impairment. Coordinated specialty care first episode psychosis teams, I'm sure you are familiar with these types of issues and concerns. When listing these bullet points, I was struck by knowing the opportunities that we have within the FEP teams: counseling, medication management, family support and education, case management services, et cetera. And in some places, cognitive remediation programs can assist with each bullet point on this slide. The good news about FEP teams intervening early is that we have a better chance to get someone here to the good cognitive health place that we discussed earlier. Gold standard of care being early intervention by FEP teams and, if indicated, cognitive remediation. Cognitive remediation is a rehabilitation therapy that hopes to reduce cognitive deficits. But as far as duration of untreated psychosis, we know that the sooner someone begins treatment, the better their prognosis. Why? Because with early treatment, some people may never have another psychotic episode. For others, psychosis may be a recurring symptom of schizophrenia. However, even if someone continues to experience symptoms, early treatment provides that foundation for recovery and for a meaningful life. Lifestyle changes are difficult because change is difficult. In cognitive remediation, the goal of having cognitive improvements transferred to daily life is challenging for many people with mental illness who have lived for long periods of time in a cognitively understimulating environment. In the same way you might be prescribed medication or physical therapy for diseases or injuries, you might be recommended a cognitive remediation program by your psychiatrist, counselor, or other care provider. Cognitive enhancement therapy, or CET, is a program where participants work at recovery through structured group and computer exercises. And action-based cognitive remediation, ABCR, uses goal setting, behavioral activation, and role plays to show how new cognitive strategies are used with real-life tasks. Both of those programs are available through the Best Center. And in the same way that you would need to continue medication or treatment for persistent or chronic illnesses or injuries, you would need to continue your cognitive remediation programs in order to maintain the cognitive gains that you receive. Experts say that the following are key to the best care for someone with cognitive impairment. Good care. Careful choice and dosing of medications will help you avoid cognitive side effects. All the things that make up a coordinated specialty care first episode psychosis program, a well-rounded treatment team that addresses not only the illness or injury, but the actual deficits themselves. We know that a positive attitude about learning helps people make the best use of their cognitive skills. A supportive and stimulating social and physical environment encourages people to cope better with their cognitive problems overall. And going back to attitude curiosity, those with severe mental illness tend to underestimate themselves and their abilities, which leads them to avoid cognitively challenging activities during treatment and in daily life. So in the cognitive remediation treatment environment, a good therapist is needed to play a key role in refocusing the client on the goal of approaching those cognitively challenging activities, giving praise and reinforcing everything from showing up to completing a program. If you are trying to maintain your cognitive health, consider things on the right column. Reducing risks to cognitive health, consider those things that are within your control to improve your brain health. Taking care of your physical health, things like managing high blood pressure, eating well, being physically active, keeping your mind active. So think about this, what kind of things do you think of when keeping your mind active? Hobbies, volunteering, learning a new skill, which is awesome for your brain and it boosts self-esteem, and it might engage you socially with people. Staying connected with social activities. Studies show how people who engage in personally meaningful and productive activities with others tend to live longer, boost their mood, and have a sense of purpose. These activities help maintain well-being and may improve your cognitive function. And managing stress. Many stress relieving activities have multiple benefits. So think about like exercise with a friend. So that includes social, keeping your mind active, and keeping your physical health up. All right, so I wanted to end by just saying, or just asking what teams have observed when working with people struggling with poor cognitive health. What are your experiences with this? Does anyone maybe have an example of watching someone who is struggling with poor cognitive health make improvements through working with their FEP team? And lastly, just thank you so much for your attention.